All right, so Joel Embiid is undergoing a procedure. There's a flap, there's a meniscus tear, but we're not allowed, it seems like, to call it a surgery. Trey, as someone who's dealt with a meniscus tear before, can you explain the club that you guys are a part of, that you and Joel Embiid, the TMC club, the triple meniscus club?
Run TMC. Yeah, man.
Walk, TMC, right?
roll in a.
Well, the run is kind of X'd out, but yes. Yeah, it's more of a common sports injury now. You know what I'm saying? But I think that's from inflammation. I think that's more of weak hips that goes to like not taking care of your feet. I think someone mentioned it. I want to say Nate Jones or someone else that Nate Jones quote retweeted was about Joel Embiid's weight. I think he needs to lose a lot of weight, and that's kind of like starting to affect his more injuries and common things of that nature. But over time,
was that what got you, Trey, when you were teaching?
No, it wasn't weight. It wasn't weight at all. I think I just had wear and tear from my knees. I think I was just kind of like the way I jumped down from the step was kind of aggressive, and I would have probably done a little bit more damage if I was still on the court. I just didn't know. I hadn't been to the doctor in years. So when me playing on it, I didn't have much tissue left. But in these terms of flap, I'm curious to know, and I go back and listen to this. Hey, Doc.
Hey, guys.
The more of why we can't use the word surgery in reports, and then also... I don't work for anybody anymore. So I just went out there and just said he tore his meniscus. And everybody's like, how do you know? And I'm like, well, the flap and this and that. And I'm gonna just be the expert out here of someone who has torn not one, but two meniscus. That is a torn one. But I'm gonna let the expert speak on it.
Trey, thank you for your testimonial as someone who has torn their meniscus and an athlete. Thank you, Trey. And he's got to run. But he's subbing out, and we're subbing in the doc, Brian Sutterer. Thank you, Trey. Brian, we've known each other for quite a while. You're one of the best at explaining sports injuries. You have a great YouTube channel, which I want you to pump. And on Twitter, you had a lot of commentary on this particular Joel Embiid injury. And I am fascinated by the intersection of sports medicine and injuries and the way that the media reports these injuries and what sticks out to you. When Joel Embiid gets out, his teammate Kelly Oubre was saying, man, what do you want him to do? He's 350 pounds. Like, he's a 7-foot big man. He can't play all these games. And he has this knee injury. And I'm sure people like you are like, all right, I'm stepping in. I'm going to try to figure out what's going on here. But you're only able to rely on the information that national reporters are letting out. And so what you've read? What is the terminology what you've read, and why does it strike such a chord with you?
I've been following this all for quite a few years now. And this is probably one of the situations that stands out the most is just confusing. And when things are confusing in terms of the reporting, the language, the terminology, I always try and think, what's the motive? Is there some motivation for why things don't seem as straightforward and clear? And I can't figure out what the motivation is in this case, but it's been extremely confusing from the start. And I think it all began when there was so much pushback about this is a meniscus injury. It's not a tear, right? That was the first big pushback, is people started saying tear, and no, it's not a tear. It's just an injury. Semantics here aside, like when we're dealing with a meniscus injury is a tear. There's no reason to confuse people and make it sound more convoluted. So that was the first part of it. And then when we hear about, I think the official release from the 76ers said he's undergoing a corrective procedure. I have never heard anybody describe a surgery for a meniscus tear as a corrective procedure. It's baffling. I don't understand why there's been so much convoluted, confusing terminology around the reporting of this. And fans are smart enough nowadays, right? We all know the difference between a repair and a removal, and they can't fool people with this terminology. And so it's been such a confusing story to try and follow that. I still don't feel like we have a great understanding of what actually is the injury and what they're doing when they go in there for the surgery.
So the injury, according to ESPN's Adrian Wojnarowski, breaking news, this was yesterday, 76ers star Joel Embiid, the reigning MVP, will undergo a procedure this week to repair a left meniscus injury, a team official tells ESPN. A recovery timeline is expected after procedure, but expectation is that he will miss an extended period of time.
Yeah, there's a lot of layers of of just what are we doing here? I mean, call a spade at some point, right? He has a tear in his meniscus. He's having a surgery. I think, you wonder if Woj using the word repair was appropriate, right? Because by all accounts, if you repair the meniscus, that means you go in and you try and sew the torn pieces back together. That is a 4 to 6 month recovery. And so that is something that if they are truly going in there with the intention of repairing his meniscus, I don't understand why you would put hope out there about returning for the postseason. I mean, that seems like by all accounts, you should just assume the season is over, but yet they're saying there's a chance he comes back. So who knows? Maybe the
Brian,
word repair
I
was
think
not
you've
appropriate.
I think you've pretty much gotten onto the motive right there.
Yeah.
Like
that could be it. Yeah, maybe they're just trying to not rule it out.
To soften it and make it seem like he will be back. Even if
and
that is
maybe
not
that's
the
the motivation.
But why put that on Joel? Like this is the thing. Like with the Aaron Rodgers thing too, where it's like holding the fans' hope that they're going to come back miraculously and defy the history of the human body. That's putting pressure on Joel Embiid in a way that it's like, now he's going to have to answer questions like, where are you on your recovery timeline, on your rehab? Are you still like holding out hope that you're going to come back and rescue us in the postseason? I just think that's unfair. That's setting an inappropriate timeline for him.
And then it pushes him to maybe come back sooner than he feels like he should, right? Because he's already got all this pressure around him. And then if come, May, it's like, hey, where are you, man? They said you might be back. He's like, wait a minute. This is a 4 to 6 month recovery, but yet I'm getting all this pressure. I agree. When you think about the pressure on him, that's another layer of this. And I just don't understand. I was hoping that it was just some of the telephone and the reporting that was getting to Woj, where it was all this corrective procedure, et cetera. But the Sixers' own report said corrective procedure. It's like, what are you guys doing? You're just confusing your fans and making everybody irritated with this. Just say he's having a surgery. I don't know who's giving these reports out. I don't know who's trying to word it, but they certainly are not helping Joel's case either with all this.
Now, but that's just it, though, Brian, is you had the generous assumption that everyone is educated enough to know that a surgery means this timeline. And that's why we have experts like you to come in and weigh in, and we have access to your information, which was, 10, 15, 20 years ago, we did not have. But I think that the 76ers and Joel Embiid's agents and whoever is responsible for the specific verbiage that was put out in the statements does not share that same belief that everybody is well educated enough and do think that they can get one over on the mass audience, the general public. And that's the reason for the lack of clarity and transparency.
Yeah, and I'd give them that out 5, 6, 7 years ago, right? Before there were a lot of people like myself who were trying to do this education. But now, I mean, you can't even say meniscus tear on social media without people asking, is it a repair? Is it a resection, right? We all very clearly understand the difference there. And there's so much weight behind using that word repair. And I think I always wonder how one of our, common good friends, Jeff Stotts, does this when he's looking back at his old injury reports and he sees meniscus surgery, right? That is a huge difference if somebody's having a repair versus a resection, that I think in just the last few years we've latched onto that. And I would hope that Woj understands versus that.
A what? You just use the word
resection. Yeah, just like removing
I don't know what that means. Yeah.
So resection is just cutting out the torn piece. Yeah.
Removal?
So
is that like the same thing?
Removal, resection. Yeah, same thing.
Okay.
Yeah.
All right. I'm learning.
But you would hope that Woj understands the difference there, right? That when he sees that report, or when Sham sees that report of it's going to be a repair, that he's, that he maybe asks, like, you guys mean repair, like the one where but maybe not, you never know. But I feel terrible for Sixers fans, and you brought up a good point with Joel trying to deal with the confusion now surrounding when he actually could realistically return.
but you have 755,000 subscribers to your YouTube channel, which is Brian Sutterer, MD. This video content has taken off, sports injuries, and you explaining the diagnosis or the prognosis, what this all means. Do you feel like every reporter should have a class with Brian Sutterer and sports doctors or just experts on injuries, because it's such a huge part of the conversation now? Is whether it's Aaron Rodgers or LeBron's age or foot injuries, turf toe, all this sort of thing. There's a reason why you have 700,000 subscribers, is because people are interested and they don't know this stuff.
I go back and forth with that question all the time, because I'll be honest, in the 5 years now that I've been doing this, I can probably count on less than two hands the number of times that I've gotten, requests. It's kind of been the same people, but nobody has reached out to say, hey, be our medical contributor, right? There's never been a question posed of, hey, we want somebody to work for XYZ organization to be our sort of medical editor. And at one point I really fought it and thought that's crazy, they should, but I've kind of come around on it. I just don't think people want to have an expert telling them this stuff, because then it removes the ability for them to have more content and speculate and be back and forth and be wrong about it, right? Because, concussions is a perfect example. You can go on an NFL show and the host can go back and forth all day about head injuries and the NFL and should tackle football be banned and this and that. And they can do that because they don't have the authority of that, those letters after their name. But if you bring on a doctor, you suddenly remove the ability to speculate and have more content. And so I think, honestly, some of these networks they like the ability to sit here and have a bunch of podcasts and shows and talk about Embiid's meniscus in ways that don't really require them to have the authority with it. But then as soon as you bring in an authority, you kind of remove that ability to speculate and go back and forth. And also, I just think it's kind of a bummer to talk about injuries sometimes, and networks maybe don't want that. But I think
let's go to commercial. The guy is unconscious on the field. Let's take us out. The Eagles.
Hey, doctor, come in here. Yeah, no one really wants to hear that. So, but I agree. I mean, I think people clearly have shown an interest in this stuff. People clearly want to learn more, which has been really cool to see. And so I think everybody that is doing any significant writing, sports media should have some type of a medical person or editor that they can just run stuff by, not to be, going over a thing with a fine-tooth comb, but just to say, hey, is this reasonable? Does this make sense? What questions should I ask? I mean, we do that with every other area of journalism. We bring in experts to contribute to the story that we're saying, yet somehow with sports medicine topics, there has not been any of that. And I don't see that changing in the near future, to be honest, just because there doesn't really seem to be that much of a push for it currently.
I wonder if the injury came out to the Sixers and his agent, Joel Embiid, and it was bad news. And they have to come up with a way to frame it to keep people invested in the story of the Sixers and keep watching the Sixers. And hey, how do we frame this in a way that people won't be tuning out? And the extended period of time, it used to be out indefinitely, but now if we don't want to pinpoint a timetable, we're going to go with an extended period of time. That means nothing, right? Like that, no. Like in terms of from your desk, it's 4 to 6 months because that's what a repair, usually the timeline is. And my second question is, you mentioned how no one in your line of work calls it like a corrective procedure. Is surgery stigmatized in a way that, like, when you're dealing with athletes and you have to like couch, hey, I think we're going to have to go with surgery here. Do you kind of have to do a soft landing with your patients? Like, hey, I know it's a big word, surgery, and it's stigmatized, but we got to do it.
Yeah, I don't, because I think our athletes are smart enough to know what you're telling them. Like if I try and beat around the bush and say, oh, we're going to, do this minimally invasive, corrective, innovative technique to try and salve it. Like they're smart enough. They know when we're just blowing smoke up their butt to try and make it sound fluffier. And so I'm very direct. Like, you need a surgery. So the way that I would present this, if I'm in charge of writing that press release, is you say, Joel Embiid has been diagnosed with a tear in his meniscus. We are undergoing further evaluation to figure out what we need to do. Great. That's the initial report. There's a tear in the meniscus. We're figuring it out. Next, you decide you're having surgery. He's undergoing surgery. The hope is that we can repair the meniscus, but the outcome might change once we do surgery. Like, just keep it simple, keep it straightforward. So no, I would never describe it as a corrective procedure. And it's also a little bit misleading because it implies, right, if you hear that you're having a corrective procedure to something in your body, you assume that that means it's going to go back to normal, right? It's being corrected. But whenever we do these meniscus surgeries, I mean, there's no guarantee that everything is, quote, back to normal. I mean, that meniscus is never truly back to normal in the state it was before the injury. But yet when you call it a corrective procedure, it implies that you're almost like giving him a new meniscus, or you're making it go back 100% to normal when he's already had a meniscus surgery once before, and that meniscus is never going to look 100% normal. But again, going back to what we said about the player, it puts even more pressure on the player of, well, they corrected your meniscus, right? They corrected it. They fixed it. Why are you still having pain and issues? And so there's a lot of power in those words when you specify even that you're correcting it, because they might get in there for the surgery and find that, you know what, we thought we would go in there and be able to stitch the tear back together, which is good long term. It's better to be able to do that for his knee prognosis. But man, when we got in there, the tissue just wasn't as viable as we hoped. The tissue couldn't be repaired, so we had to just cut out the torn piece. And then that would change this to where now we are looking at a 4 to 6 week recovery period. So you might get in there and not be able to, quote unquote, correct it.
Yeah, because I guess there is uncertainty, and it's important to acknowledge that we don't know how bad it is or what the timeline is, but until we go in there. I think that's a misconception, is that I think diagnosing that he has a torn meniscus, that there is a hard timeline before you go in there. But what you're saying is you don't really know until you go in there and see the damage.
Yeah, until you get in there. I mean, there's a great example, Von Miller in the NFL. I don't mean to switch sports, but right, all the reports came out, his ACL's fine, there's no ACL damage, and they get in there for the surgery and he gets out and we learn they reconstructed his ACL, right? And so there's times, you know, the MRI is not perfect. There's a lot of times you might get in there and, you know, we went in with the intent of doing one surgery, but once we actually got in there and we're looking at the tissue, we found we had to change course a little bit. And so, yeah, that's very possible that we find out after his surgery that, you know what, they weren't able to do a repair, and now suddenly it's only going to be a 4 to 6 week recovery window. But that's what you should tell people ahead of time, right? You should set people up for that expectation up front so that then your doctors also don't look bad if they go in there and have to change what they're doing, which is very plausible.
Last thing here, and then we'll let you go, Brian. Thanks so much for joining us. We kind of touched on it, the weight stuff. Kelly Oubre was hyperbolizing a little bit. It's a little sensational, being like, dude, the guy's 350 pounds. He's trying to play on a knee that's bothering him. They give him a break. So how much does the weight variable impact Joel Embiid's future going forward? Is that meniscus injury? And
yeah, when we just look at meniscus injuries, you know, there is some correlation with BMI, and I know BMI is not a great indicator of health, especially when you've got somebody with a lot of muscle mass. But the bigger you are, the more weight you're putting through your joint, the more force and stress that's being put through these tissues. And so if you think about, if they repair it, that means they've put stitches inside his meniscus to try and bring those torn pieces back together. Whenever they first do surgery and you come out, you don't put weight on it, because if you put too much weight through that joint, you can disrupt the healing that's trying to take place where that tear was sewn back together. And in that same aspect, the more weight you're putting through the joint, the more weight you're putting through your meniscus, the more weight you're putting through the cartilage. So yeah, there is definitely a direct physics correlation of how much weight you carry and how much load that goes through your joints, that the more weight you have, the harder it can be. It can be some, maybe a little bit longer recovery, more risk of a meniscus injury. The alternative, though, I mean, it's a good conversation to have, but the alternative is not really realistic, right? Because it's not like Embiid is, you know, obese, right? He doesn't carry around necessarily a lot of extra body fat that we could easily say, oh, go lose 40 pounds. If Embiid starts to lose a bunch of weight, he necessarily doesn't stay Joel Embiid. And so it's a good conversation to think about. But at the end of the day, you know, it's probably not going to change anything. You know, I think it certainly influences the potential for some of these injuries, especially some of the foot stuff we see in big men, because there's simply just more weight. There's more force going through your joints. And it's not like he has special cartilage that's different than ours necessarily that can tolerate more weight. The benefit is you have more muscle that can offload the joint, and the muscle protects the joint more when you're heavier. But yeah, I think it's something to consider. But when the alternative is potentially him not being as strong and big as physical as he is, that changes who he is as a player, which then might not make him, Joel Embiid anymore.
Yeah. I just think some guys are not built to be 82 game players, and that's a whole nother conversation.
Yeah.
But
right. I mean, I don't think the human body was designed to weigh 285 pounds and run up and down a basketball court and jump 40 inches in the air 80 nights a year for 10 years. I mean, I don't think our bodies were built to do that. And, we've certainly seen that in some former players and some current players now.
That's Brian Sutterer. He is one of my favorite follows on Twitter. He educates me so much on sports injuries. Brian, can you pump up your Twitter and your YouTube channel for the listeners who want to get more of this stuff?
Absolutely. Thanks a lot. Just Brian Sutterer, MD, easy to find me on YouTube. I'm not on Instagram. I'm not on TikTok. I am on Twitter. So Twitter is kind of my main outlet other than YouTube. But yeah, I appreciate it. It's really fun. I really enjoy seeing people just interested in learning and that fascination with wanting to know more. And hopefully I can keep putting that across in an interesting and helpful way for you guys. So thanks for having me on.
That segment did not feel like surgery. That felt like a corrective procedure.
Yeah, I feel corrected. I'm with you. Thanks, Brian.
Thank you, Brian.
Thanks, guys. Take care.